Hi everyone, my name is González. I am a medical student of Universidad Autónoma de Durango campus in Monclova, and today I want to talk to you of one of the most important chronic disease like is diabetes. So we are in English Medical 2, and as our final project I want to talk to you about the topic helping patients with diabetes. So the first for all, what is diabetes mellitus? Diabetes mellitus is a chronic disease that occurs either when our body doesn't produce enough insulin, or maybe also when our body produces insulin but is not effectively use the insulin that it produces. So the insulin is a hormone that regulates blood sugar levels. It's the main source of energy of our body. Insulin, which is made by the pancreas and also helps enter the glucose into the cells. So we have three types of diabetes. Diabetes type 1, it's a condition in which our immune systems destroys the insulin making in our cells, more specific in the pancreas. So it's usually diagnosed in the children. That is why this condition is also called like juvenile diabetes. In other case, we have type 2 diabetes. Type 2 diabetes is a lifelong disease that keeps our body from using insulin the way it should. The people in these conditions, they have insulin resistance and mainly attack all people. It's important to mention. So we have a particular case. It's about gestational diabetes. It's a special one because occurs during pregnancy, and this woman and possibly their children are also at increased risk of containing type 2 diabetes in the future. But well, what are the characteristic symptoms and signs of a diabetes mellitus? Well, we know the characteristic and specific signs and symptoms of a diabetic person, like polyuria, polydipsia, and polyphagia. Polydipsia is a condition to describe an excessive thirst. So, in these conditions, you may feel thirsty all the time. And polyuria is the term used to describe a condition in which you are passing more urine than normal. And finally, we have polyphagia. Basically describes an excessive hunger. So now you know the characteristic signs and symptoms of a diabetic person. So you need to be careful with these situations because it's just the beginning of one of the most risky chronic disease. So take care about you. And now we have 8 risk factors of diabetes. One of them is age about 40 years old. Also, inactive lifestyle and high blood pressure, particular case like gestational diabetes, family history, and impaired glucose tolerance. And now we have the treatment. People with type 1 of diabetes requires insulin, and people with type 2 diabetes can be treated with an oral medication, and sometimes these people also requires insulin. We have blood levels for the diagnosis of diabetes and also pre-diabetes. A blood sample will be taken after the overnight fast. A fasting blood sugar levels less than 110 milligrams per deciliter is normal. For other case, a blood sugar levels of 200 milligrams per deciliter or higher suggests diabetes. And finally, I will give you a little recommendations for you because you will change your life if you make it. So these recommendations includes healthy eating, regular exercise, weight loss, and in my opinion, the most important point of here is the support with your family, because with them you can do it everything that you want and you will change your life. So you only have to monitoring your blood glucose levels. And this is all for me, hoping it will be useful for you and for your family. Take care of yourself because the most important for us is your health.